That one question is because as a surgeon, thoracic surgeon, we have changed our surgical procedures and treatment modalities right now, and based on the epidemiology, more and more early stages lung cancer. As you said, you have already done a lot of research, clinical research for the early cases. The first question is for stage 1A, 1A1 or 1A2 patients, even 1A3 patients, if the CTR rate is not so high, for example, around 0.5, do you still perform lymphadenectomy or lymph node sampling during surgery, or you do nothing, just a sublobar resection? This is the first question. The second question is for the research. You showed some results about the survival curve. The figures show that there were some discrepancy about the two survival lines, but there is no p-values. So what's your opinion about these kind of phenomena? If there is no statistical significance, but you can see some trends in the figure, what's your opinion about these kind of research results? Two questions. Thank you so much.
Thank you for your question. The second question, I didn't hear clearly. You mean which figure?
Survival rate, overall survival curve.
Survival curve for which one?
Yeah. Before that, you showed that there was a clinical research that the two lines, they're separated, but there's no significance. The p-value, there's no p-value.
You mean the small cell lung cancer?
Yes.
Okay.
And what's your name? Yeah, thank you so much.
For your first question for the GGO lung cancer, especially for the CTR below 0.5 or 0.25, I still perform the lymph node sampling during my surgery. I still perform. However, I do believe maybe there's no lymph nodes involvement, but from the guideline, from the patients, their preference, I still perform the lymph node sampling. And also I have a clinical trial join. There are two clinical trials I enjoy with other experts, and we also want to testing from the prospective clinical trial to testing whether lymph nodes metastasis, whether they have in this very early stage and almost pure GGO lung cancer. So I still perform the sampling. For the second question, for the small cell lung cancer, yes, we find that the lobectomy is better than the sublobar resection. However, the p-value has no big difference, and I asked my student to reconsider all the patients whether they have the adjuvant therapy, chemotherapy. Yes, they all have the adjuvant chemotherapy. From this point, I think the small cell lung cancer already, although they have the very early stage 1, let's say 2A, I still believe we should not ignore the systemic treatment for the early stage lung cancer. I think the adjuvant chemotherapy maybe is more important than the surgery type, lobectomy or sublobar resection. Chemotherapy is very important for small cell lung cancer. This is the key. Thank you.
Okay, thank you, Professor.